Alrighty, so this is part 2, the demonstration of gua sha with John Caldwell. And I am going to have my lower back worked on. I was out picking up some leaves and twigs here. And so I have a little bit of back pain. So I'll go ahead and take it away, John. Just tell me what you need me to do.
All right. Gua sha is one of the simplest massage techniques there is that I've run into. It requires nothing but a little oil, and if you could hold this up a little
Sure.
bit, so we can just get to this area. Requires nothing but a little oil. This is olive oil, and something with a smooth, rounded edge. And as I said, a jar lid is just about ideal. What I find in Noelle's back is some hard muscle here.
Yeah.
You feel a little bit of tenderness in that area. I find this area is a little stiff.
Yeah, there it is.
Now, hard muscle tissue does not mean that there is going to be congested blood associated with that. But the main thing that we're working toward here is to soften the muscle tissue, which means it will function normally and pain-free.
I like that idea.
Over here we have some hard muscle tissue there also.
I feel it more on my right side, but yeah.
Let's see what this produces. As you can see, this is a typical jar lid. In this area, I would go either down the back or I would go from the spine out. And as you can see, already there is congested blood coming to the surface.
Wow.
As I said, that is not the objective. The objective here is to return stiff, hard muscle tissue to a smooth, soft state. And as you can see, this is getting quite dark. I can feel the muscle relaxing. I can feel it getting smoother and softer as I work. In many cases, the person receiving this technique can feel the pain going out of the muscle as you work on it. And this is the point here. Now, how was that pressure? How did that feel to you?
It was tolerable, but I really felt it.
You, okay. But easily within tolerance level.
Oh, yeah.
There was not
No, it wasn't.
really painful.
No.
Here I will have to stop because this blood is thick enough that it might be possible to produce a blood blister if I pulled more of this congested blood out of the tissue. So here I will have to stop. Okay. Here I will also, it's getting thick enough that I don't want to continue in the same place. I can go down a little bit further and see what happens.
So it's a way of just like breaking up a very tight muscle back to its.
Well,
I don't know.
The second principle here is the same thing that we do in any kind of massage, with any kind of massage technique. We have to separate the fibers of the muscle when they have gotten stuck together. Muscle tissue tends to adhere to itself, and the fibers have to be independent of each other for the muscle to function properly. So the pressure that I can put on with the edge of this jar lid is very effective at breaking apart the fibers of the muscle tissue.
Well, how often would you do this? Just whenever you felt pain, and how long would you do it, or you know, how does that work?
Definitely when you feel pain
Mm-hmm.
or stiffness. If you're used to the sensation of normal muscle tissue, and you can feel hardness developing in the muscle tissue,
Mm-hmm.
that will tell you that you need to get some work.
Okay.
That's about it. If for a massage therapist,
Mm-hmm.
it's that feeling of hardness in the muscle.
Mm-hmm.
If you have lumps in the muscle, or if you have a hard stringy sensation in the muscle,
Mm-hmm.
that tells you that internally it's getting stuck together
Mm-hmm.
and it needs to be released.
So it's kind of like you're combing all the tangles out of my muscles, huh?
That's a good image. And as I palpate again,
Mm-hmm.
I can feel
Mm-hmm.
it's much softer.
Yeah, I can feel that
In
difference.
this area where I was talking about, where it's especially congested,
Mm-hmm.
there is still some hardness in the muscle, and that will need more work later.
Mm-hmm.
This redness will disappear probably in 3 days.
Mm-hmm.
I doubt that it will take longer than that. It may take, there may be a little bit something, might take a little longer than that, 4 days maybe. But when it's rather thick,
Mm-hmm.
and a person is not used to receiving this, it seems to take a bit longer for it to fade away.
Okay.
Usually there will be no bruising,
Mm-hmm.
but sometimes it will form what looks like a bruise,
Mm-hmm.
which will take a little longer to go away.
Okay. So can you use this technique with other techniques, or would you do this before, during, or after a typical type of, I don't know what type of massage, Swedish massage or deep tissue, or?
You can do this in conjunction with almost any other kind of massage.
Mm-hmm.
If you were doing a Swedish massage and your client knew about the technique, and you had already discussed this with your client,
Mm-hmm.
you could grab a jar lid. If you found an area of stiff muscle,
Mm-hmm.
you could grab a jar lid in the middle of your massage, take a few strokes over the area,
Mm-hmm.
and then just continue with your massage.
Mm-hmm. Okay. Now, will this procedure itself make me sore? Should I expect any soreness from this?
As in the case with producing bloody congestion coming to the surface,
Mm-hmm.
that will be different for every person,
Okay.
and it will be different with every treatment.
Okay.
Sometimes this area will be sore, sometimes it will feel tender to the touch.
Mm-hmm.
That could last usually 1 to 3 days.
Mm-hmm.
If a person has some unusual
Mm-hmm.
condition, like fibromyalgia, for example,
Mm-hmm.
it could last up to 2 weeks actually.
Wow.
But in that case, you're working with muscle tissue that is already very sore.
Mm-hmm. Mm-hmm. I was gonna, can somebody, I mean, you did have, well, you didn't know whether you had fibromyalgia, but
mhm.
is it really painful to do it? Was it painful to do it to yourself when you had that?
It was painful for me, yes.
Mm-hmm. But it was something well worth it, though.
That was the point.
Yeah, I guess so.
I was already very familiar
Mm-hmm.
with the kind of
Mm-hmm.
stiffness and pain that I was dealing with,
Mm-hmm.
and as soon as I started doing this and began to feel the results,
Mm-hmm.
it no longer mattered to me. I knew I was going to get fast results,
Mm-hmm.
and I was very willing to put up with a little bit of discomfort
Mm-hmm.
to overcome the condition.
Well, I would certainly do that versus taking drugs, you know, or letting the you know, the debilitating pain go on, that's for sure.
Okay.
How's
Now,
this side looking?
on this side,
Mm-hmm.
as was the case with the first side,
Mm-hmm.
we're reaching a point here where it's thick enough that I would want to stop.
Mm-hmm.
We'll let this reabsorb over the next few days. And if you wanted to continue this treatment,
Mm-hmm.
then I would say probably within 5 days to a week,
Mm-hmm.
you could get another treatment and
Okay.
continue the process.
Okay.
But it's
So is that 5 days, is that a typical interval for treatment or what?
again, it will vary with the
Mhm.
with the case. Excuse me. It will vary with the individual
Okay.
and with the severity of the condition.
Okay. Now, can I get in the hot tub tonight?
Yes. I would keep this area out of sunlight
Mm-hmm.
for at least a day.
Okay.
I would not do any heavy lifting.
Okay.
Give yourself at least 24 hours.
Okay.
All right. Doesn't mean you have to totally pamper yourself. You can
Why
do
not?
normal activities. All right.
Okay.
I'm going to rub off a little excess oil.
Okay.
But you were the ideal example.
All right. Okay. So thank you, John.
Yes.
And I guess we had a little look at that, and appreciate your tuning in. And again, that's Wausau, and also taught by Dr. Oz.
Finally, I should mention
Mm-hmm.
contraindications.
Mm-hmm.
You would not use this over broken or irritated skin.
Mm-hmm.
You would not use this with any in an area where there is something that protrudes above the skin level, like a wart or a mole,
Okay.
that could possibly tear.
Mm-hmm.
You would not use it where there's already symptoms of inflammation, heat, redness, swelling, and pain.
Mm-hmm.
You would need to consider if the person bruises very easily, that would be a consideration.
Okay.
You would not want to do it where there's possibility of a blood clot
Mm-hmm.
being loosened and traveling through the circulatory system. So that means where there are varicosities,
Mm-hmm.
we would avoid an area where there are varicose veins.
Mm-hmm. Good.
And of course, in the elderly, you would have to evaluate each case individually for fragility of the skin.
Mm-hmm. Gets very, very weak, doesn't it?
Yes, yes.
Yeah.
So,
detrimental. Mm-hmm.
so in the case of elderly people, you have to watch out for that sort of thing. And then, of course, there are blood thinning medications which can also be a factor.
So if they were on a blood thinner, they would probably not be a candidate for this type of therapy.
Each case has to be evaluated individually.
Okay.
You can't make a generalization.
Okay, very good.
Because I have treated people who were on blood thinners
Mm-hmm.
and it was fine.
Oh, okay.
But some people may not do as well.
Okay.
So
Is there any type of certification that somebody should look for in this technique?
actually, at this point, there is not.
Oh, there isn't. Okay.
No. It's too new in this country.
Mm-hmm.
It's so little heard of that you also really cannot find that much in the way of training.
Mm-hmm.
There are, as far as I know, no workshops being offered. I expect this is going to start to develop very soon,
Mm-hmm.
but right now there are none.
Okay, so you've trained a lot of therapists in the Lynchburg, Virginia area.
Excuse me.
Oh, okay.
I did run into one, I just forgot, at the Casey Riley School in Virginia Beach.
Okay.
Virginia Beach, Virginia, as the first course, the first course I've seen offered anywhere.
Okay. Very
So
good.
I expect this now to start to develop.
Wonderful. Well, I appreciate your taking this time and fixing that lower back issue.
How's that feel now?
It feels a little warmed up and feels very loose. You know, feels, you know, I could really tell the difference when you first started working that area. It felt very tight, and as you worked it, yeah, just kind of like you combed all the tangles out of those fibers. So I appreciate it.
Great.
Thank you, John.
You're welcome.
Appreciate it.